Hello, my name is Mary Soares, and I'll be presenting on health in humanitarian emergencies along with my colleague Lena Aldos. The objective of this presentation is to discuss health as a human right, define disaster, discuss some classifications of disasters, identify challenges of maintaining health rights in complex humanitarian emergencies, as well as some recommendations. And when we talk about the right to health, the right to health should be an inclusive right, covering a wide range of elements that helps foster healthy lives. And it goes beyond just access to health care. Some of the key aspects of the right to health are accessibility. It must provide affordable health facilities, goods, and services that are within physical reach to everyone without discrimination. Availability. Functioning public health and healthcare facilities, good quality medically appropriate facilities and healthcare. Acceptability. Culturally appropriate and gender sensitive facilities and services that follow medical ethics. Participation. Healthcare stakeholders are involved and have a voice in designing and implementing health policies. Accountability. Providers and states must meet public health rights obligations and be held accountable if they fail to do so. And entitlements. People are entitled to the right to prevention, treatment, and control of diseases, given access to essential medicines, and maternal, child, and reproductive health, among other entitlements, which are vital to achieve the highest attainable level of health. But what happens to the right to health when a disaster occurs? A disaster is defined as a serious disruption of the functioning of a society, causing widespread human, material, or environmental losses which exceed the ability of the affected society to cope using its own resources. When we classify disasters, there are disasters that can be addressed at the local or national level. Others, there are major humanitarian emergencies that require international aid. But when it is associated with political instability and armed conflict, it becomes a complex humanitarian emergency. And some of the challenges faced during complex humanitarian emergencies include violence and loss of life, extensive human displacement, massive need for humanitarian assistance, lack of access to provide the humanitarian aid, and safety concerns to relieve workers providing the humanitarian aid.
In order to fully recognize and identify the right to health, we must first understand the definition of the right to health according to international legal instruments, including the International Covenant on Economic, Social, and Cultural Rights, which states that the right to health is the right to the enjoyment of the highest attainable standard of physical and mental health. And they also illustrated various steps on how countries or states can follow to ensure that this right is satisfied for their citizens. And there are also a lot of various international treaties that recognize the right to health and globally. Once we fully understand the definition of the right to health according to international law, we start to identify, or we begin to identify, human rights violations of the right to health in war-torn countries, for example. For this example specifically, we can look at how the Physicians for Human Rights began to investigate human rights violation of the right to health in northern Syria. For a long time, the front or the argument to persecute Assad and his allies for human rights violations focused on torture, killings, and bombings, or the use of chemical weapons. But more recently, the argument shift to focus on the right to health to bring a stronger front for persecuting perpetrators of war crimes. And in this report specifically, the Physicians for Human Rights, they interviewed physicians and medical personnel and civilians and pointed out or highlighted their accounts of um, attacks on hospitals, their injuries, or how Assad and his allies have prevented any supplies or any help from or any support from reaching northern Syria. And this also outlines that when we talk about the right to health or violations of the right to health, we don't have to specifically focus on attacks on hospitals or clinics. We can also focus on the social determinants that are linked to our health. For example, Assad and his allies are also preventing food and other supplies from reaching northern Syria, which is one of the social determinants of our health. So that also highlights human rights violations linked to the right to health. Another example of a human right violation of the right to health is the unfortunate and ongoing conflict in Ukraine. And more recently, the WHO and NPHW started to highlight how attacking hospitals and clinics in Ukraine is also a human rights violation, in addition to the many other human rights violations that Russia continued to commit in the region. But this one specifically, we're also beginning to shift the focus on the right to health as a human right violation, as opposed to just a general human right violation of bombing civilians and attacking civilians. And I also wanted to highlight the unfortunate incident in the bottom right picture. This is one of the many pictures that actually stuck with me till today. This mother and her unborn child actually died later on after the attack on the hospital where she was about to give birth in Ukraine. So just to highlight how detrimental these attacks are on civilians, especially those who are about to give birth or in hospital for treatment, which are even more vulnerable. So now after we saw how the attacks on healthcare are considered a human rights violation in Syria or Ukraine, how are these attacks monitored and how are UN agencies or the WHO surveilling these attacks or knowing about them in the first place? So in late 2017, the WHO created a surveillance system of attacks on healthcare to collect data on where these attacks happen and how are they affecting the country's healthcare system in general. So this SSA collects data. There are WHO representatives or representatives a part of the Ministry of Health in that region who collect data and they submit it to the SSA. And the data is used for surveilling and monitoring these attacks and making it publicly available to the public so that people are aware of these attacks and aware of how they affect healthcare systems and how important healthcare systems are to a country's infrastructure. So the right picture, you can see this is just a screenshot I actually took on from the SSA website, and you can see how the latest documented attacks are from Ukraine because of the ongoing conflict with Russia. So this data is really important, and the fact that it's publicly available really brings awareness of these attacks and how they're impacting civilians and the healthcare system in the country. So now that we have a data collection method and we have the data to see how these attacks are happening, where they're happening, who they're affecting, and how who is even perpetrating these attacks in the first place. So we have all of this data. How can we hold these perpetrators accountable for their actions and war crimes? Unfortunately, as indicated in a report by Meyer et al., is that the WHO, due to its political um, structure, they don't have the capacity to identify perpetrator and hold them accountable for their actions, even though they do still have the data that clearly identifies specific perpetrators for their war crimes. The WHO cannot identify them. And in this report, they said it's due to the political makeup of the WHO and which states or which countries' interests are affecting policies or affecting policies in the region where this war crime is happening. So the WHO simply uses this data to quote unquote raise awareness of these attacks, and they refuse to identify the responsible parties of these attacks on healthcare. So even though we have the data, we can't hold people accountable, or we can't hold countries accountable for their war crimes, which is very, very unfortunate. So this is one of the very challenges of using data or using research available on attacks on healthcare, and how can we use it to hold perpetrators accountable for their war crimes. As I mentioned before, the WHO is very politically driven, which is a challenge when holding perpetrators accountable and responsible for their war crimes. However, there are other challenges with data collection within the monitoring and surveillance of attacks on healthcare, including the fact that there are political obstacles with country level buy in. Certain countries don't want SSA to be collected, so the international or global communities are not aware of their crimes, and SSA is still not considered a public health priority. There are also methodological gaps, including the fact that there's still a lack of contextual factors, including in the data that is being collected. We still don't understand the full story of what happened. We just have the numbers, the number of attacks, and where these attacks happened, but we don't have any other contextual data. There's also a misalignment or the lack of alignment with similar reports. And if we have one organization or the SSA having one report or one data source, there are other organizations who have data on the same attacks or different data on the same attacks, and there's no way to combine these two data sources together. And if we do find this way, we can have a comprehensive story of what happened and how these attacks come to happen. And there's also no set evaluation methods to go back and investigate the accuracy of the data being reported and how true it is to what actually happened. So all of this together, and with how the WHO is still politically driven, there's still a lack of accountability of perpetrators of war crimes. So on the community level, what we can do is we can use all of this data, and we can advocate and bring awareness of what happens through social media or through taking other action and communicating with our representatives in the government so they can vote and support decisions that persecute perpetrators of war crimes and those with attack in healthcare systems in international courts. And once we do that, we can start to build reforms to integrate WHO country offices into the SSA. We can start to provide resources and protections to staff performing research and collecting data. We can highlight SSA as a public health priority and defend SSA when data contradicts member state country motives. And we can also start to standardize SSA as an evidence-based, accurate, and reliable surveillance system in all countries. And this standardization really starts to have countries, think twice before they commit their war crimes, knowing that this data is being reported in their country. And finally, we need to emphasize the collection of contextual details and data collection methods so we can understand the full story of what happened and who committed these war crimes. Thank you so much for listening to our presentation, and please don't hesitate to reach out if you have any questions about the information that we presented on, or if you need more resources on how you can understand human rights violation and attacks on healthcare, or how can you raise awareness and advocate for the right to health in humanitarian emergencies?